What is better, sacrospinous ligament suspension or uterosacral ligament suspension? Okay, very specific question, just to give a background to the audience. So these are both surgical procedures that we do to treat somebody who's suffering with pelvic organ prolapse. And these surgeries specifically, they are what we call native tissue repair, meaning these are surgeries where we're using the patient's own tissues to do the repair, as opposed to using a mesh, which is an artificial synthetic material, to do the repair. So I'm not going to talk about mesh because that's a completely different topic. But going back to your question, which one is better, sacrospinous ligament suspension or uterosacral ligament suspension? The answer is they're very comparable based on the data that we have. A lot of the times it really depends on what your ligament looks like, truth be told. Because again, a uterosacral ligament is different than the sacrospinous ligament. And for a lot of patients, the uterosacral ligament may not be as strong. So when you do the suspension with that, maybe the repair will not hold very well. Similarly, there are certain specific criteria that we have as surgeons that we use to determine whether or not we can do a procedure like a sacrospinous ligament suspension, depending on what is the length of your vagina, whether we're doing it just on one side or two sides, whether you have the uterus there or not. The overarching answer is yes, they're very comparable. But again, based on your particular situation, the quality of your ligaments, that answer can vary, but that's a very specific determination based on what your exam is, how significant your prolapse is. So that's a great conversation to have with your urogynecologist. And if somebody who can evaluate you, assess what your prolapse is, what's the severity of your prolapse, and then give you their best clinical judgment.